Hello everyone. In this video, we will discuss about the pharmacology of antibacterials. But antibacterials is a very long topic, so I decided to cut it into parts. So in this video, we will discuss the first part, which is about the cell wall synthesis and the cell membrane function inhibitors. But before we discuss the antimicrobial or antibacterial agents, let's just have a review of some of the basic information about antimicrobial. So when you say antimicrobial drugs, they are only effective in the treatment of infections because of their selective toxicity. And that is, they have the ability to injure or kill an invading microorganism without harming the cells of the host. So the selective toxicity is actually only relative, okay? It's not absolute. And it requires that the concentration of the drug be carefully controlled to attack the microorganism while still being tolerated by the host. So it means that the concentration is enough to kill or stop the growth of microorganism without the host being affected. So once the dose is increased, the tendency would be it would cause also, that's the time that it will cause toxic reactions to the host. So that's what they call selective toxicity. Okay, so the antibiotics is being classified, okay, or antimicrobial is being classified in many ways. Number one, they are classified by their chemical structures, okay? So based on their chemical structure, for example, beta-lactam antibiotics, okay? So the structure of beta-lactam antibiotics has, of course, a beta-lactam ring. Second is they are classified according to the mechanism of actions. For example, antibacterial that are inhibitors of cell walls synthesis, okay, or they are inhibitors of the protein synthesis. So that's according to mechanism of action. The third classification is by their activity against particular types of organisms. For example, if the antimicrobial drugs is against a bacteria, so they are called antibacterial. So if their action is on viruses, they are called antiviral drugs. Okay, so if their action is on fungal infections, so they are antifungal agents. Okay, so when we say antibiotics, they are a type of antimicrobial agents. No? They are a type of antimicrobial designed to target bacterial infections. Okay, so they are designed to target bacterial infections within or on the body. Okay, so the definition would be any substance that inhibits the growth and replication of a bacterium or it kills it outright. So that is an antibiotic. So let's discuss the classification. Okay, so for antibiotics, antibiotics are classified as narrow spectrum. It means it only act on a certain number of bacteria, or it can be classified as broad spectrum, meaning it can kill or prevent the growth of many bacteria. Okay, or antibiotics can be classified as bacteriostatic or bactericidal. Okay, so when we say bacteriostatic, it prevents the growth of the microorganisms, and when we say bactericidal, it kills the microorganisms. Also, antibiotics are classified according to the mechanisms of action. So the first one is the inhibitors of cell wall synthesis. Second is antibiotic is classified as inhibitors of cell membrane function. It also classified as inhibitors of nucleic acid function and synthesis. And then it also classified as inhibitors of protein synthesis, as well as it also classified as inhibitors of metabolism. But in this video, we will be focusing more on, or we will be focusing on the inhibitors of cell wall synthesis as well as the inhibitors of cell membrane function. Okay, so let's review first the structure of the bacterial cell. Okay, so this is the bacterial cell. The outermost part is the cell wall, followed by the cell membrane and the cytoplasm. Okay, so inside are the organelles. We have the DNA, okay, and we have the ribosomes. Okay, so each type or each class of antibiotics will act on the different structure of the cell wall, the bacterial cell. Okay, so for this one, we have here the cell wall synthesis inhibitors. Okay, so they act, of course, on the cell wall. And then we have here the cellular membrane dysfunction, specifically the lipopeptides, the drug daptomycin. They disrupt, okay, the function of the cell membrane. And we have here the DNA synthesis inhibitors. Example of this class is the fluoroquinolones. Okay, so they inhibit the synthesis of DNA. Okay, so they act directly on the DNA. And then we have here the protein synthesis inhibitors. So it depends on what subunits. So we have antibiotics that act on the 50 subunits of the ribosomes. Examples are the oxazolidones. Okay, so they act on the 50 subunits of the ribosomes. So thus disrupting the synthesis of proteins. So we also have antibacterial or antibiotics that act on the 30S. Okay, so on this lower part of the ribosomes, they act to prevent or to stop the synthesis of proteins. So example of these antibiotics are the aminoglycosides. And we also have here the inhibitor of the folate synthesis. Okay, so we have this example is the Cotri, no? The sulfamethoxazole trimethoprim. So they inhibit the folic acid. Okay. So in this video, once again, we will be discussing about the cell wall synthesis inhibitors as well as the cellular membrane dysfunction. So the next series of these videos will be discussing about the rest of the antibiotics. Okay. So for the cell wall synthesis inhibitors, okay, so the bacterial cell wall is composed of a polymer called peptidoglycan. Okay, so peptidoglycan consists of glycan units joined to each other by the peptide cross-links. Okay, so in this image, you can see this is the bacterial cell wall of a gram-positive as well as the cell wall of the gram-negative. Okay, so just a comparison. So they have different structure in their cell wall. So for gram-positive bacteria, they have a thick peptidoglycan. However, in gram-negative bacteria, they only have small portion, okay, thin. The peptidoglycan is thin layer only. However, this gram-negative bacteria has an outer lipid membrane, okay? So they have an outer lipid membrane while the gram-positive bacteria has nothing, wala. Okay, so the structure of the peptidoglycan, so if we're going to examine each strand of peptidoglycan, it looks like this one. Okay, so peptidoglycan is an alternating copolymer of the NAG and the NAG and NAM. When you say NAG, that's N-acetyl-D-glucosamine, and the NAM is the N-acetylmuramic acid. So the structure would be like this. Okay, so we have here the NAG, and then next is NAM, NAG, NAM, NAG, NAM. Okay, so the arrangement is like that. So ganito ang itsura niya. And they are being attached, no, by a peptide. So merong cross-link dito. Okay, that's tinatawag natin peptaglycine cross-link. Okay, so ina-attach yan siya dyan. So ngayon, what's the role of peptidoglycan? Okay, so peptidoglycan serves a structural role in the bacterial cell wall. So it gives structural strength to the bacterial cell wall. Kaya naging strong, no, or strong yung cell wall nila. And they counteract the osmotic pressure of the cytoplasm. Okay, so take note that the cytoplasm of a bacterial cell is hypertonic. Okay, so to resist the osmotic pressure within the cytoplasm, the cell wall should be strong enough. Okay, so that's why peptidoglycan gives that structural strength to counteract the osmotic pressure of the cytoplasm. And also, it involves in binary fission during bacterial cell reproduction. So in this part ng cell wall, dito nangyayari yung binary fission. Kaya nagre-reproduce yung bacteria. Okay, so once again, this is the classification of antibiotics based on the mechanisms of action. We have the inhibitor of cell wall synthesis, inhibitors of cell membrane function, inhibitors of nucleic acid function and synthesis, inhibitors of protein synthesis, and inhibitors of metabolism. So we will discuss the rest of the classification of antibiotics on the next video. But for now, we will discuss the inhibitors of cell wall synthesis as well as the inhibitors of cell membrane function. So examples of antibiotics that belongs to cell wall synthesis, we have the beta-lactam antibiotics and the vancomycin. So beta-lactam antibiotics are penicillins, cephalosporins, carbapenems, and monobactams. Okay, so for the inhibitors of cell membrane function, we have this special antibiotics, what we call the daptomycin. Okay, just to give you an idea of what is the beta-lactam. Okay, so common beta-lactam's ring is common to this antibiotics. Okay, so common for penicillin, cephalosporins, the acyl D-alanine, D-alanine, the monobactams, and the carbapenems. So ito yung beta-lactam ring nila. Okay, so ito yung mga rings. Kaya these beta-lactams are sensitive, no, to beta-lactamase enzymes produced by bacteria. Yun yung main, kumbaga, main action ng bacteria kung paano nila i-inhibit or gawing inactive metabolites yung mga antibiotics. Kaya nagiging resistant sila sa these types of antibiotics. Resistant sila sa mga beta-lactams because they hydrolyze the beta-lactam ring. Sisirain nila yung beta-lactam ring. Okay, so first classification under beta-lactam antibiotics, we have penicillins. Okay, so example of penicillins are amoxicillin, ampicillin, dicloxacillin, nafcillin, oxacillin, PenG, PenV, piperacillin, and picaracillin. Okay, examples, they are examples. So in bacteria class, they have, in their cell wall, they have this what we call PBPs. Okay, so PBPs stands for penicillin binding proteins. So the function of these PBPs, okay, so they are enzymes. They are bacterial enzymes involved in the synthesis of the cell wall. Sila yung tumutulong para makabuo ng cell wall. And also in the maintenance of morphologic features of the bacterium. Okay, so ano ngayon ang mechanisms of action ng penicillins? The penicillins interfere with the last step of bacterial cell wall synthesis. Okay, so they interfere doon sa last step ng paggawa ng cell wall, specifically sa transpeptidation or cross-linkage. Okay, so penicillins will bind to penicillin binding proteins. After that, they inhibit the transpeptidase catalyzed reaction. So the result would be there is no cross-linkage. So if you remember our picture last time, so the NAB and the NAM is being connected. Okay, kinoconnect yan siya. So yung action ng penicillin dito is they prevent, okay, the transpeptidation or the cross-linkage. So hindi na magko-cross-link yung NAB at saka, yung NAG at saka NAM. So there would be no synthesis of cell wall. Okay. At the same time, one also of the actions of penicillin is once they inhibit the what we call this bacteria, the synthesis of cell wall, the tendency of the bacteria now will produce an autolysin. So nagiging nag-auto-lyse ang bacteria. Okay? Okay, so antibiotics or antibacterial belong to this one. First is we have PEN-G and the PEN-V, so penicillin G and penicillin V. They are the natural penicillins. Okay, so PEN-G, or what we call benzyl penicillin, is the cornerstone of therapy for infections caused by gram-positive and gram-negative cocci, gram-positive bacilli, and the spirochetes. They are actually susceptible to inactivation of beta-lactamases or tinatawag nating penicillinase. Okay, so these are enzymes produced by bacteria to make them resistant to antibiotics. Okay, so penicillins remain the drug of choice for the treatment of gas gangrene, okay, which is caused by Clostridium perfringens, and also the drug of choice for the treatment of syphilis, which is caused by the Treponema pallidum. Okay, so for penicillin V, they have similar spectrum to that of penicillin. Okay, so they are narrow spectrum antibiotics. And one of the disadvantage of this PEN-V is that it cannot be used for the treatment of bacteremia or the infection in the blood because of its poor oral absorption. So it can only be used for skin and tissue infection. And it is more acid stable, but however, PEN-V is more acid stable compared to PEN-G. Okay, so it is often employed orally in the treatment of infections. So PEN-G actually is in IV form. There is no oral form for PEN-G because it cannot tolerate, it will be destroyed in the acid in our stomach. However, the PEN-V can be given orally. Okay, so next generation of penicillins we have what we call the anti-staphylococcal penicillins. So they are methicillin, napsilin, oxacillin, and dicloxacillin. So I give a mnemonics MNAD para mas mabilis memorize. Okay, so we have methicillin, napsilin, oxacillin, and dicloxacillin. So these anti-staphylococcal penicillins are beta-lactamase or penicillinase resistant penicillins. Okay, so they are not affected with the enzymes produced by bacteria. Okay, the enzymes specifically beta-lactamase enzymes. Okay, so their use is restricted to the treatment of infections caused by penicillinase producing staph or staphylococci, including the methicillin-sensitive Staphylococcus aureus. Okay, so restricted lang sila for the infections caused by penicillins producing staph like MSSA. And they have minimal to no activity against gram-negative infections. So that is why CMNAD is considered a narrow spectrum antibiotics. They are effective on the gram-positive bacteria, but very little or even no activity against gram-negative infections or gram-negative bacteria. Okay, so next one, we have the ampicillin and amoxicillin. Ampicillin and amoxicillin are considered the extended spectrum penicillins. Okay, so extended spectrum sila. So they have an antibacterial spectrum similar to that of PEN-G, but are more effective against gram-negative bacilli. So in this case, the ampicillin and amoxicillin has an activity against gram-negative bacilli. And take note, ampicillin is the drug of choice for the gram-positive bacillus, Listeria monocytogenes, okay? And also for the susceptible enterococcal species. And the amoxicillin, this is actually used as a prophylaxis during dental extraction. Okay, so that patient will be prevented from having bacterial endocarditis. So ginagamit siya as prophylaxis. Okay, so these extended spectrum agents are also widely used in the treatment of respiratory infections. However, Same with other beta-lactamase beta-lactamase na susceptible na mga antibiotics, they can also nagkakaroon na din ng development ng resistance, okay, which become now a major clinical problems. Okay, so to prevent the action of the beta-lactamase or the beta-lactamases, no, some penicillins are added with clavulanic acid or sulbactam. Okay, so we have amoxicillin plus clavulanic acid. We have the co-amoxiclav. Okay, so clavulanic acid or sulbactam is added because they act as an inhibitor of the beta-lactamase enzyme. Okay, so they protect the enzymatic hydrolysis and extends the antimicrobial spectra of the penicillins. So that is why ina-add sila sa formulation. Okay, so just a review of the beta-lactamase. Okay, so for penicillin, this is the chemical structure of penicillin, and this is the chemical structure of cephalosporin. So both have beta-lactam ring. So the action of beta-lactamase is they hydrolyze the beta-lactam ring, okay, and making the structure of penicillin inactive, okay, and they produce inactive metabolites. So making the antibiotics inactive. Yun yung action ng mga beta-lactamases. So that is why it's important, no, to add beta-lactamase inhibitors to extend the spectrum of antibiotics. Okay, and also to, yan, sabi natin, no, para ma-extend yung antimicrobial spectra nila. Okay, so we have here the higher class of penicillins. Now we have piperacillin and ticarcillin. So this antibiotics is considered the anti-pseudomonal penicillins, ang tawag sa kanila. Okay, so they are active against Pseudomonas aeruginosa. Okay, so these antibiotics are available only in parenteral formulations. They are effective against many gram-negative bacilli. Okay, so they act now on a gram-negative bacilli. And however, they have no effect on Klebsiella because of its constitutive penicillinase. Okay, so it also being affected by the penicillinase enzyme. Okay, so that is why they are formulated together with clavulanic acid or tazobactam. Okay, so this is to extend the antimicrobial spectrum of the antibiotics. Okay, and this is to include the penicillinase producing organism. So nasama na niya dong mga microorganism na nag-produce ng penicillinase, okay, or yung mga beta-lactamase na producing in bacteria. Okay, so once dinagdagan ng beta-lactamase inhibitors like the clavulanic acid and the tazobactam. Okay, so those are penicillins. Now let's discuss the pharmacokinetics, no, of those antibiotics. For the absorption, food decreased the absorption of the penicillinase-resistant penicillins, the M now, you remember. Okay, so those are penicillinase-resistant penicillins. So pag sinasamahan sila ng food, it decreases the absorption, okay, of those antibiotics because as gastric emptying time increases, the drugs are destroyed by stomach acid. So that is why they should be taken on an empty stomach. Okay, so para mas mabilis yung absorption nila. Next is distribution. The beta-lactam antibiotics distribute well throughout the body. Okay, mas nadidistribute siya, mabilis siyang nadidistribute. And take note that all penicillins cross the placental barrier. So it will cross the placenta, but none have been shown to have teratogenic effects. Okay, and penetration into bone or cerebrospinal fluid or sa CSF is insufficient for therapy unless these sites are inflamed. So for the excretion, they are primarily extruded renally, okay, specifically on through the organic acid tubular secretory system of the kidney, as well as by glomerular filtration. Okay, so they are excreted via active tubular secretion and glomerular filtration. That is why for a patient who has impaired renal function, it is a must that dosage regimen should be adjusted. Okay, so however, my exemption, we have naphthalene and oxacillin, which are primarily metabolized in the liver. So no need for those adjustments, okay, for patient who has renal insufficiency. And one of the drug interactions with penicillins is when it is given with probenecid. Okay, so the mechanism of interaction would be probenecid inhibits the secretion of penicillins by competing for the active tubular secretion. Okay, so they compete on the active tubular secretion. Okay, that's via the organic acid transporter and thus increase blood levels of penicillin. So instead that penicillin is being secreted via active tubular secretion, when it is given together with probenecid, so nakakaroon ng competition on the site of excretion. So ang mangyayari is penicillin will not be excreted and it will accumulate in the blood. Thus, results in increased toxicity and side effects. Okay, so once again, take note that penicillin are also excreted in breast milk. Common adverse effects or adverse reactions by penicillins, we have hypersensitivity or allergic reactions, diarrhea, nephritis, specifically for methicillin. We have neurotoxicity and hematologic toxicities. Okay, those are common adverse reactions of penicillins. Now let's proceed to the second class of antibiotics that act on the cell wall or that inhibits the cell wall synthesis. The second is what we call the cephalosporins. Cephalosporins has been classified as the first, second, third, fourth, and advanced generation or the fifth generation. They are based largely on their bacterial susceptibility patterns and resistance to beta-lactamases. Okay, so cephalosporin classification is based on the susceptibility, okay, and also on the resistance to beta-lactamases. Okay, so we have here the action of the cephalosporins on the bacteria, no, on the gram-positive and gram-negative bacteria, and doon natin malalaman, no, yung ma-identify yung action ng mga generations na to. Okay, so for the first generation cephalosporins, this first generation cephalosporins act primarily on the gram-positive cocci, although they also have actions on gram-negative rods like the E. coli, Klebsiella, and the Proteus mirabilis. Okay, but principally they are mas ano yung action nila, no, doon sa gram-positive bacteria. So sa second generation now, if you can notice, okay, so nag-widen yung spectrum. Okay, so they act on the second they act on the they act on the positive gram-positive bacteria as well as they have actions on the gram-negative bacteria. And if you notice, mas wider ang or broad ang spectrum nito because mas madami yung coverage, no, ng gram-negative bacteria compared mo sa first generation. Okay, now let's compare that to the third generation cephalosporins. So in third generation cephalosporins, lumiit yung action niya doon sa gram-positive bacteria, but nag-wider yung action niya doon sa gram-negative bacteria. Okay, so if you can notice, yung first generation, yung action niya is more on the gram-positive, less sa gram-negative. Okay, so pagdating ng second generation, nabawasan ng konti doon sa gram-positive and nagwa-wider ang action niya doon sa gram-negative. Okay, so dumami yung nagwa-wide yung spectrum niya doon sa gram-negative. So pagdating sa third generation, mas kukonte na lang no, yung action niya doon sa gram-negative, gram-positive, and mas dumami. Okay, mas naging wider yung spectrum niya doon sa gram-negative bacteria. Now for the fourth generation, we have the only one antibiotics belong to this one. We have the cefepime, which must be administered parenterally. And this is usually reserved for more severe infections. Okay, so must broad see fourth generation. Okay, and more action on the gram-negative bacteria. So it has a wide antibacterial spectrum. Okay, with activity against streptococci and staphylococci. Okay, but only those that are methicillin susceptible. They also have action in aerobic gram-negative organisms. They also have actions on Enterobacter species, E. coli, Klebsiella pneumoniae, Proteus mirabilis, and Pseudomonas aeruginosa. Okay, so the action of the fourth generation cephalosporins, okay, is wider now compared to the first, second, and the third. Now for the fifth generation, or what we call the advanced generation cephalosporins, we have one drug belong to this one. We have ceftaroline. Okay, so ceftaroline is a broad spectrum advanced generation cephalosporin that is administered IV as a prodrug, ceftaroline fosamail. Okay, so this antibiotic is the only commercially available beta-lactam with activity against MRSA. Okay, so MRSA is methicillin-resistant Staphylococcus aureus. So it's indicated for the treatment of complicated skin and skin structure infections and community-acquired pneumonia. So siya yung ginagamit no, sa community-acquired pneumonia. Actually, this is for severe, especially for severe infections. Okay, so for the cephalosporins, agents belong to the first generations are cefazoline, cephalothene, cefaperin, cephradine, cefadroxil, and cephalexin. For the second generation, we have cefaclor, cefiroxim, cefprozil, cefmetazole, cefotetan, and cefoxitin. For the third generation, we have cefotaxim, ceftazidime, ceftriaxone, cefadroxim, and cefixim. In the fourth generation, we have cefepime, and the fifth generation, we have ceftaroline. Now for the distribution of cephalosporins, all cephalosporins distributed very well into the body fluids. Okay, so same with penicillins, they are distributed very well in the body. And most cephalosporins do not penetrate the CSF, no? Especially the first and the second generation cephalosporins, they do not penetrate the cerebrospinal fluid. But the third generation, they can achieve therapeutic levels in cerebrospinal fluid. So we have here the drug cefazoline. Okay, cefazoline is a first generation, no, cephalosporin. So this drug is commonly used as a single prophylaxis dose prior to surgery. Siya yung laging ginagamit as prophylactic agent no, before surgery because of its half-life, which 1.8 hours, and its activity against penicillinase producing S. aureus. Okay, so it is active against penicillinase producing S. aureus. And cefazoline is effective for most surgical procedure, including the orthopedic surgery, because of its ability to penetrate the bone. So it can penetrate the bones also. But take note that all cephalosporins cross the placenta. For the eliminations, cephalosporins are eliminated through tubular secretion and or glomerular filtration. So same with penicillins. No? So doses may be adjusted in case of renal dysfunction to guard against accumulation and toxicity. Para may iwasan ang toxicity. However, exempted si ceftriaxone because ceftriaxone is excreted through the bile and into the feces. Okay, so it is employed or it is used in patients with renal insufficiency. Common adverse effects, we have allergic reactions. And take note of this, that For those patients who has anaphylactic response or severe allergic reactions, no, or those patients who develop Steven-Johnson syndrome or nagkakaroon ng toxic epidermal necrolysis due to penicillins, they should not receive cephalosporins. Okay? But for those na milder penicillin allergy, cephalosporins should be, or pwede din, it should be avoided, no, or used with caution for those individuals with penicillin allergy. Okay, so ang possible na mangyayari kasi is magkakaroon ng cross-sensitization, cross-sensitization. So those patients na allergic with penicillin should avoid or use with caution. Okay, kung may alternative, use the alternative one. Okay, the third class of antibiotics that inhibits the cell wall synthesis is the carbapenems. Carbapenems, example of carbapenems are imipenem, meropenem, doripenem, and ertapenem. This imipenem is formulated in combination with cilastatin. Okay, so ang action ni cilastatin is to protect the imipenem from metabolism by renal dihydropeptidase. Okay, so renal dihydropeptidase and the enzyme that made the imipenem metabolize the imipenem into inactive metabolite. So si cilastatin, siya yung nagpo-protect ng imipenem drug. Okay, so si imipenem can be used as an empiric therapy. Okay, so they act on they are active against beta-lactamase producing gram-positive as well as gram-negative organisms, anaerobes, and Pseudomonas aeruginosa. So binibigay siya agad, no? Kahit na hindi pa na-identify ano yung main causative microorganism that was the infection. Kasi wide, napaka-broad ang spectrum nila. Cover nila yung mga gram-positive and gram-negative organisms, as well as those producing the beta-lactamase enzymes, also the anaerobic and the Pseudomonas aeruginosa. So imipenem, cilastatin, and meropenem, they are administered intravenously, okay? And they penetrate well into the body tissues as well as body fluids, including the cerebrospinal fluid when the meninges are inflamed. Okay, so meropenem is known to reach therapeutic levels in bacterial meningitis even without inflammation. Even without inflammation sa mga meninges, so si meropenem can still achieve therapeutic levels. So they are also excreted via glomerular filtration. So once again, dose adjustment is necessary for renal insufficiency. Okay, so for patient with renal dysfunction. The fourth classification of antibiotics that belongs to cell wall synthesis inhibitors is what we call the monobactams. Okay, so under this monobactams, we have Astraeonam. Astraeonam is the only commercially available monobactam. So it has antimicrobial activity directed against or primarily against gram-negative pathogens. Okay, so sample nito is Enterobacteriaceae and the Pseudomonas aeruginosa. And it lacks activity against gram-positive organisms and anaerobes. Okay, so they are specific on the gram-negative pathogens. And for the other antibiotics that also act on the as inhibitors of cell wall synthesis, we have the vancomycin. So vancomycin is a tricyclic glycopeptide that has become increasingly important in the treatment of life-threatening MRSA and methicillin-resistant Staphylococcus epidermidis, okay, or the MRSE infection. So restricting the use of vancomycin to the treatment of serious infections caused by beta-lactam resistant. So kumbaga, the use of vancomycin is restricted only for the treatment of serious infection caused by beta-lactam resistant gram-positive microorganisms or gram-positive infections in patients who have a serious allergy to beta-lactams. Okay, so if the patient has allergies or serious allergies to beta-lactams, and the patient has serious infections caused by beta-lactam resistant microorganisms, then that's the time that vancomycin should be used. So IV vancomycin is used in individuals with prosthetic heart valves and in patients undergoing implantation with prosthetic devices. Okay, so don't forget that it will come out in your board exam. So ito yun, IV vancomycin ang ginagamit, no, for those individuals with prosthetic heart valves and in patients undergoing implantation with prosthetic devices, especially in those hospitals where there are high rates of MRSA or MRSE. Okay, so si vancomycin ang binibigay doon. Okay, so to give you an idea of the coverage of vancomycin, okay, so they are active on gram-positive cocci as well as gram-positive bacteria or bacilli, and they are active on anaerobic organism like the Clostridium species, no, and also on actinomyces. Okay, now for the cell membrane disruptors, we have the daptomycin. Okay, so daptomycin is a bactericidal, okay, bactericidal concentration-dependent cyclic lipopeptide. Okay, so cyclic lipopeptide antibiotic siya. It is an alternative for treating infections caused by resistant gram-positive organisms, including MRSA and vancomycin-resistant enterococci. Okay, so kumbaga, those microorganisms that develop resistant with the vancomycin, so ang options should be to give daptomycin. The mechanism of actions, okay, so it involves insertion of the lipophilic daptomycin tail. Kumbaga sa structure ng daptomycin, meron siyang lipophilic tail, okay? So those tail is being inserted in the bacterial cell membrane. So it causes rapid membrane depolarization and potassium ion efflux. So the potassium ions will go out, okay, from the cytoplasm kasi nagli-leak na yung cell membrane. Okay? So this is followed by the arrest of DNA. So namamatay ang DNA, RNA, and na-disrupt yung protein synthesis, which will result in bacterial cell death. Okay? So kaya siya bactericidal. So, in summary, dinidisrupt niya. Okay, so dinidisrupt niya yung function ng cell membrane. Okay, so the once it disrupts the action of cell membrane, it made the potassium from cytoplasm go out, no? Go out from the cell membrane. Okay, so once lumabas si potassium ion, it will cause arrest of the DNA, RNA, and stop in the protein synthesis, which will lead to bacterial cell death. Okay, so the coverage for daptomycin is for gram-positive cocci and gram-positive bacilli. Okay, so thank you for listening, and that ends our video for today. Thank you for listening and have a nice day.